I'm Ashley Miller with Weatherby Healthcare. Let me introduce you to Dr. Nicholas Kusnezov. He is a board-certified orthopedic surgeon who has found success working with locum tenens. Thanks for chatting with me today, Doctor.
Yeah, thanks. Excited to be here.
So we're going to get right into it. How long have you been working locums?
So I've been actively engaged in locums for about 4 years solid. I think it's exciting, it's rewarding. I think, you get to travel, and I think it's very nice to be able to work with patients from various walks of life from all over the country.
How often would you say that you go on assignment?
My schedule is a very meticulously built kind of patchwork quilt of assignments. So it varies. I mean, it can be anywhere from, 2 a month to 5 or 6. And it really depends. And it's all about integrating that with my primary practice effectively.
For those who are unfamiliar with locums and how orthopedic surgeons kind of fit into it, why do facilities need orthopedic surgeons to work locums?
Orthopedics is one of those fields where there is an ever increasing demand and kind of an undersupply right now. So I think orthopedics is in a pinch, and I think that there are plenty of orthopedic jobs out there right now. Facilities are usually looking for locums, orthopedics included, to cover, a few different situations. One, I think the most common is holiday coverage. You have a small group of providers, no one wants to work on Christmas, and so they open a Christmas job, and that's holiday coverage. You may or may not go back to the same facility. You may be asked to do another holiday. I think the second situation is when a provider is either relieved or leaves a practice, and they end up having a hole that they need to fill. And so you end up having some holes in the schedule, and, the remaining provider or providers are overburdened, and they'll have a locum come in and fill the holes. And, I think lastly, there's some facilities that sometimes even don't have orthopedics programs, and which you are coming in as really the one of two or the only orthopedics guy in critical access hospitals.
Do you ever have a hard time finding assignments?
They're all over the place. You'll find assignments from every state, kind of in random assortment coming through the email on a monthly or weekly basis. And so there's always something out there. And moreover, there have been plenty of situations where I've reached out to hospitals and linked them up with locums companies, and established a rapport that way. So I think that there's really many untapped springs out there for assignments, and there's never been an issue with me finding enough assignments. I think it's usually the opposite. There's too many opportunities, and I don't have the enough days in the month to do them all.
What's the best part about working locums as an orthopedic surgeon?
I think the best part about working locums as an orthopedist is really the exposure that you get to various procedures, different patient bases. It's a complement to your own practice. A lot of times out of residency, if you have a job lined up, you may end up working as a generalist or as in a specific niche, and you eventually get kind of buttonholed into, in orthopedics doing general sports or hand or, low acuity trauma. If there's a joint trained surgeon there, they may be doing all the joint replacements, or a trauma trained surgeon may be doing all the trauma. It gives you the opportunity to really expand your practice, and really, it's kind of a build your own adventure. You should always be doing things that you're comfortable and competent in doing, but you have the opportunity to do procedures and to deal with patients that may be generally outside of the realm of your practice primarily. Again, you might be dealing with predominantly young, healthy patients within the military, and you go out into the community in another practice and you're dealing with much older, sicker patients. So it really gives you a lot more cross-training and breadth to your practice.
How do you prepare for follow-up care for the patients that you see while you're on locums assignment, and then the patients that you care for during your permanent practice?
As a locum, it's easy to kind of wash your hands when you leave an assignment, because, you really are under no contractual obligation to follow up with the facility or the providers or the patients. You really want to focus on being a good physician and delivering the best possible care. I think that the best thing to do is just keep an open line of communication with providers and support personnel. I always have the direct numbers to clinic managers, to physical therapists who see my patients, and to the other partners there at the practice, if there are any. So that, if patients are following up and they have questions on their, post-operative restrictions, or whether they wanted to follow up, with x-rays, or how they were doing with physical therapy, or unexpected issues arise, which they always do. I think that it's good to be roped in, and again, on a real-time basis with people who are taking care of the patients. Then there's your primary practice too, that you don't want to compromise by, going overboard and going to locums and having the same issue with your patients in your primary practice. So again, I would just stress communicating the plan of cares to your partner and making sure that all lines of communication are open to facilitate any issues.
That's great information for orthopedic surgeons interested in working locum tenens. I appreciate you sharing that, and thank you for spending some time with me today.
Yeah, thank you so much.